After surgery, you will be transferred to the ICU unit, where you will remain in intensive care under the close observation of the specially trained nurses and senior anesthesiologist Dr. Werner. Our anesthesiologists instruct each patient on how to control the pain themselves. In Heidi's case, everything has gone well. She can now regulate her own painkiller intake via the epidural catheter. Dr. Werner is making his round. He is talking about a patient who asked for the operation lamp to be turned to such a position so that she could watch the course of the operation in its reflection.
One of the operation lamps as a mirror.
That's what I asked. That's what I did.
Yeah.
I even asked them to take the blind down, but they wouldn't. But I watched.
Yeah, really?
And I didn't have headphones. I wanted to see what was happening. Yeah, it was
interesting.
Cool. Yeah.
Yeah.
Yeah, very. Shit, I was getting tired. So far, so good. Before I came, I did upper body weight lifting. Mm-hmm. But I didn't do this. Okay.
The next day, September the 23rd, Ward 1, physical therapy in bed.
Just here, the incision, it's sore. So when you tighten your muscles here, press inside.
So you got more than one.
Inside, in this direction. Okay. Press more? Yeah, here, a little bit.
For the next 5 days or so, Dr. Teschel will monitor your progress. Your physical therapist will work with you on active back and isometric exercises and on passive therapy, including massage and PECs, until you feel well and active again, and Dr. Teschel approves your release from the hospital. The time it takes to attain optimum condition varies from one individual to the next. We give pain medication as it's needed, based on the individual requirements of our patients. Our goal is a pain-free post-operative phase.
So good.
Good job, Heidi. 40 minutes past your hour and a half.
Well, last night I did it in 2-hour intervals.
Wir legen dem Patienten vor der Operation einen Schmerzkatheter.
Before surgery, we enter a catheter to apply pain medication. It will later be connected to this device. By pressing this button, it allows the patient to supply his or herself with pain medication.
Hi.
Hi.
Good morning.
Good morning.
How was the night?
It was pretty good. I'm
Yeah.
feeling better.
Could you stand the pain in the night?
I had to push the button a couple
Yeah.
times.
And you had a
It was-
benefit from it? From
Oh,
the
yeah.
machine, yeah?
Yeah, it helped right away.
Okay.
So.
Let me see. Darüber hinaus sind wir mittlerweile
We've therefore turned to performing the surgery under local rather than general anesthetics, if the patient agrees.
Vollnarkosen zu machen, weil dieser Schmerzkatheter eine absolut
In actual
schmerzfreie
fact, it
Operation
allows pain-free surgery.
ermöglicht, ohne dass in jedem Fall eine Vollnarkose gegeben werden müsste. Patienten
Patients who are fearful of general anesthetic benefit from this method in particular.
Please take the tooth to the nose
both sides. Press down the knee in the bank, like here. Extension. Okay. Press down your back in the bank. Press down both arms, right side, left side, a little bit more to your body. Down, and make a double chin. Okay. Now open your hands and think you want to carry a very heavy weight to the roof. Start with the right side. There are 10 buttons on your hand. You want to bring it to the roof. Here you think you pull a very heavy weight, pull it down slowly back to the bank. And that exercise you repeat 3 times. And pull it down again. Open your hand, get up to the roof, and down, and make a rest. Stop.
The case shown in this film is a typical one. However, each individual case needs different exercises. We will supply you with leaflets in which you will find instructions for your post-operative exercises. Your therapist will show you your personal do's and don'ts to ensure optimal recuperation. Most of our patients are able to learn and find out by themselves how much they can do. We'd like to emphasize how important this is for your recovery. Be careful not to overdo it. Listen to what your body is telling you.
And get up to the wall, and down. And now you make a little flexion, as much you can. Go up, like a cat. Make a little flexion in your vertebra, okay? And up, looking to the wall. Now, from this position, we go in flexion to the left knee, okay? Up, flexion in the vertebra. Everything okay?
What did I say? That I start to cry, and she says, "Don't be afraid." And I said, "It's okay, I'm happy, because I haven't been able to bend like that in 2 years."
Okay. Come on, a little bit backwards to me. A little bit backwards.